He fell off the couch.
He was on the back of the couch. He fell down.
Oh, off the back.
And yeah, kind of a high back.
Yeah.
And when he hit, it evidently hit wrong.
Yeah. Did he cry out in pain right when that happened? Yeah.
Yeah. And he cried several times. He ran around the couch there.
Yeah.
He had one leg cut, that right rear leg cut out, and I picked him up and I felt the leg, you know. And he didn't, you know, he didn't flinch or do anything, you know, when I touched it. So it seemed the touch didn't seem to be a problem.
Yeah. And so, has it gotten better or worse?
Probably a little bit better, but he comes and goes.
Yeah.
He can go hours and act like there's nothing wrong, and all of a sudden he'll, when he's running around, he'll get that one leg up, or he'll be favoring it when he's.
Was it worse first thing in the morning when he gets up real stiff, or is it seem to?
I never noticed so much in the morning.
As the day goes on, does he seem to get weary with it, or it gets worse?
I did notice yesterday that after he'd been sitting for a while, he got up and laying like this for a while, and he got up and he was kind of stiff.
And he's 2 years old?
He's about 3.
Okay.
On 3.
Yeah. He's never had any problems like that with his back or his legs before?
No.
Okay, let's put him up here. We'll take a look.
Yeah.
What do you say, little Rambo?
I think he's a heavy one because he was chewing the other ones up.
Oh, that's smart.
Oh, he's a little light on it. I can see right there. Touch your foot. That doesn't hurt, huh?
Good job, Rambo.
You're doing good. You feel your knee.
I couldn't find anything, any place on there where it seemed to hurt him.
Yeah, I don't feel any swelling here. The kneecap fluctuates a little bit. Come back to that. Try to stretch your hip out. You feel this one? Yeah, you got a luxing patella there too. So his kneecap pops in and out of place. And I think that might be the source of our pain. See if I can do this. But I don't feel any excessive swelling. I don't think any joints are out of place. His knee is very stable. So he hasn't broken anything. And he hasn't popped anything out of joint. But the kneecap rides in a little groove and it pops in and out. I'll show you this model right here. This is what we have on the front of his leg, like this. Right, like this. So this is the kneecap that rides inside this tendon that rides in this groove right here. And so when I push on this with my thumb, it pops in and out. And so when that thing rubs against the edge of that bone, it starts to hurt and can bruise the bone. And so, people stand up straight, but a dog is walking like this. So this thing is tight as a bowstring all the time. And when he jumps down and that thing pops out across that ridge, can really bruise it and be real painful. And if it continues to happen over time, you can start to form arthritis there. And you might need to have surgery or something like that. But a young dog like this is the way that it feels. I think we give him an injection for the swelling and the pain and put him on a non-steroidal anti-inflammatory for 10 days. And 10 days of bed rest, and let it heal, then it may be okay. So the big thing is that we give him the pain medicine. He feels like Superman again. After 3 days, he goes out and he re-injures it. So we got to keep him still for 10 days.
What do you think, Rambo? Do you mind if I borrow him to weigh him?
No,
Oh, alright, I'll bring him right back. Come with me, people.
What questions do you have for me?
not pertaining to that, but I wanted to ask you about heart medicine. Now, we're not from, we're not originally from here.
Where are you from?
Well, he's from Oregon.
Oh, okay.
Or Washington.
Yeah.
And we moved out here a couple months ago, and I'm not not a problem back there, so I don't know.
Heartworms?
Yeah.
Really? You got so much humidity there, it seems like it would be, but I guess. I know in Colorado, they talk to a vet from there and they're just like, we don't worry about fleas, we don't worry about heartworms, you get above a certain elevation, you don't have any problems. So, in Virginia, all year round, go ahead.
Oh, she's 11 and a half.
11 and a half pounds. In Virginia, mosquitoes can breed and transmit heartworms all year round. We have a warm spell in January or February, then the mosquitoes have time to lay eggs and breed, and the mosquito transmits the heartworm from one dog to another. So they need to be on a heartworm preventative every month. So many different products on the market. So anyhow, this is the one that I recommend. It's a heartworm preventative, but it also prevents hookworms and roundworms, whipworms. Those are all in the stool. So this milbemycin is the active ingredient. There's other companies that have milbemycin plus another additive. Everybody's trying to get it all in one pill, but they're not quite there yet. So, because ticks are a bad problem. So this is another pill, once every 3 months, it does fleas and ticks. So this is one of the best effective things against fleas and ticks. And ticks are a bad thing to worry about. Fleas are ugly and gross and people see them crawling and it freaks them out. But ticks carry deadly diseases. Lyme disease is starting to become more prevalent here. So I like to do this for fleas and ticks as well as this with a heartworm. So this is once every 3 months.
Okay.
This is once a month. So we can get them started on that. Yeah. So the next guard is the same as this. This is Fluoroliner, and the next guard is Afoxoliner. It's two different molecules, they're almost the same. Next guard works for once a month, and this one works for 3 months. That's why we carry that. It ends up being cheaper over the 3-month period, and it works better, I think. I think what we should do, if we're coming back in August, let's come back and we get a little blood sample at that time and test him for heartworms, which he should not have it if you're coming from an area that doesn't have it. But if he had heartworms and we gave him one of those pills, then he could have a reaction to it, and it's like an allergic reaction. It can be very serious. So we'd like to make sure he's negative before we do that. So we'll just put that on the list next time.
Mm-hmm.
These are all donated.
Yeah.
We have some food here. Urinary SO food. Some insulin syringes. Oh look, it's a diabetic glucometer. Yeah. Lots of diabetic patients. The dogs can have diabetes just like people, and so they need the same monitoring and the strips and everything, except pets don't usually have insurance. So this becomes one of our major problems. And then a lot of people will, if they have these kind of supplies, they'll donate them back to us so that we can give them to other people, because it's just pet owners helping each other.
Littlest one don't have to have pics. A little one up and help.
Huh? And I don't need any help for this one, okay? I don't need help for this one. You could think of fart lick, but you couldn't think of intervals?
Because I don't do intervals, I do fart licks.
Okay.
Dr. Smith, that's not how you do it.
Who decides how you do it?